Hello everyone. For my hidden hunger project, I decided to focus on vitamin D. Also, my name is Jimena Boteo Barajas, and let's begin. So, what is vitamin D? Vitamin D is a fat soluble vitamin. It is highly recommended to consume this vitamin with fatty foods so the vitamin can function properly in the body. Vitamin D is naturally produced when we are exposed to the sun, it's produced on our skin. Vitamin D is an important function when regulating the absorption of calcium and phosphorus and facilitating a healthy immune system and bone function. Some of the advantages of vitamin D is that it is very important for our bone development. It keeps the bone strong. It also helps with our immune system. It prevents high blood pressure, muscle strengthening, helps with weight loss, and it also helps people that are diabetic or pre-diabetic. The recommended when it comes to vitamin D, the recommended dietary allowance and the upper intake levels. So for the RDA, the RDA allowance for adults that are 19 years and older is 600 IU, which is 15 micrograms daily for both men and women, and for adults older than 70 years old, it is recommended to take 800 IUs or 20 micrograms daily. For the UL, that is the tolerable upper intake level, it is the maximum daily intake, which is the maximum daily intake, unlikely to cause harmful effects on health. The UL for vitamin D for adults and children ages 9 and up is 4,000 IUs, which is 100 micrograms. Over 4,000 IUs is considered the toxicity level. So here on the side, I did provide a chart of the recommended RDAs for each stages. So infants up to 12 months recommended is 20 micrograms. For, like I mentioned before, people 1 to 70, 15 micrograms. Adults 71 and older, 20 micrograms. And for women that are currently pregnant or breastfeeding, it is recommended for them to take 15 micrograms. One thing I did also wanted to mention is that with vitamin D, there are some effects when it can also cause so some medications should not be taken with vitamin D. It can cause a side effect or can actually prevent the vitamin from functioning properly. So here on the bottom section, I wrote that steroids, if you take steroids and vitamin D together, it can actually lower the vitamin D levels. Vitamin D with weight loss drugs, it can make it harder to absorb vitamin D. And for people that are taking like cholesterol drugs, something that's lowering their cholesterol, it can actually block the vitamin D absorption. So food sources that are high in vitamin D, for protein, which is mostly found in fish, trout, salmon, tuna, sardines, and tilapia. It's also Vitamin D is also found in dairy and fortified foods such as milk, cheese, and yogurt. For vegetables, only on mushrooms, and for fruits, only fortified orange juice. So for my target group, I decided to focus on Hispanic women that are going through menopause and postmenopause. The reason for choosing this group is due to the majority of all Hispanic women that go through menopause are not knowledgeable on the topic. Most of the women have difficult times during this process due to not knowing what to do when it comes to their change of mood, how to stop their bone pain or bone health from declining, and don't know how to support their immune health. Many women lack this knowledge due to stigma or shame on the topic, lack of education, lack of trust when it comes to seeking medical advice. When women go through menopause, their hormones are changing, and one of the main hormones that help with bone density is estrogen. Estrogen helps with immune function and bone health. When estrogen levels decline, it causes the bone to weaken and the immune system to decline as well. Vitamin D helps slow down the process and helps keep the bone stronger, and it also helps the body fight off infections. And when women are going through menopause, like I mentioned before, their immune system does weaken. So deficiencies of vitamin D and the recommendation. So who is at a higher risk? Women who have a darker skin complexion or wear clothes that covers the majority of their body. Women that have limited sun exposure. Women who have an imbalanced diet. Women that are overweight. Some of the recommendations: when a person is deficient in vitamin D, they will experience symptoms such as fatigue, bone and joint pain, muscle weakness, and mood change. It is recommended to start taking vitamin D supplements before the age of 50. For women that are going through menopause, it is recommended to take supplements or eat a diet high in vitamin D. Mostly recommended to take this around the age of 30. Women that are overweight are most likely to be also women that are overweight are most likely to be deficient due to vitamin D. Due to the vitamins being a fat soluble, it gets stored in body fat. A high concentration of fat will cause the vitamin to be trapped in the fatty tissue and will not circulate in the bloodstream. So it's kind of recommended for them to take a slightly higher dose so it can actually be absorbed. So the name of my program is called Luz de Vida, Life of Life. Some of the ways I decide to intervene is by creating a Facebook Live nutrition classes. Since a lot of women, especially Hispanic women, tend to be on social media pretty often, especially on Facebook, I decided to target them by creating a cooking class and just focusing on cooking traditional food, but making it healthier and adding ingredients that are high in vitamin D for them. Another program that I want to implement for Luz de Vida is the Luz de Vida program. It is a program. This program is a supplementation starter class. For some women may not know the importance of taking vitamin D supplements or other supplements that are beneficial for the health. So this program will educate and provide different vitamin D supplements along with other vitamins that they can use. We will be using this program to get women tested on their vitamin, not just vitamin D, but all vitamin levels. We want to encourage women to get more physical exams and visit more OBGYNs more frequently, especially since our program is kind of like circling a lot of women that are going through menopause. And like I said, a lot of them do have biases on looking for medical advice. So we kind of want to like create a safe space and kind of encourage them to get physical checkups as often as possible. One of the things about this program is that we really want to make it available online, such as social media. We also want to like go around in different local communities centers just to promote it and get more women involved. And this program will be in English and Spanish. One of our fun programs, which is kind of like a physical intervention program. It's called Sunday Fun Day. As mentioned before, vitamin D is produced in can be naturally produced with sun exposure, but since Hispanic women tend to have a darker skin tone, they don't really get that much sun absorption. But this would encourage them to at least promote at least 30 minutes to an hour of physical activity, and they'll get some type of sun exposure, and it would also help them lose some weight, which a lot of women want to do nowadays. So this is a really great start. So the way we're gonna try to recruit women is by going to Zumba classes, after school pickup, local clinics and hospitals, through social media such as Facebook, TikTok, and Instagram. And this one is called Botanicas. This is stores that sell spiritual and herbal remedies. There's two definitions on the Botanicas. Botanicas can be the spiritual and herbal remedies, or it could also be our medication stores. So a lot of medicine that it's imported from Mexico to here, and it's more cheaper than Walmart or CVS. So, and then a lot of Hispanic women tend to go to these places. When it comes to local clinics and hospitals, like I said, it is a kind of like contradicting what I said before, but we want to go to clinics and hospitals that help Hispanic population. We think that that is a good way to spread our word and try to promote our brand. So assessments and evaluation. How I'm planning to assess this program is that in the beginning of the program, we want to reach out to Hispanic women from all ages, not just women that are going through menopause, like around the age of 40 and up. We want to focus on all women because this is something that needs to be talked about. One of the things that we're going to do is we're going to start by asking questions on what they know about the woman's cycle, their thoughts on having to go through menopause, and we want to educate and get rid of stigma on the topic of menopause. We are also going to perform blood tests on vitamin D levels to see who is deficient or not. We want to give out surveys on menopause symptoms, dietary intake surveys. We want to get a survey on their physical activity. We want to know if there's a common pattern between all the women that are participating. Towards the middle of the program, so 6 to 12 weeks, we want to implement exercise and outside workouts. We want to help with bone and muscle strengthening. We also, before I go, in the beginning of the program, we are going to be distributing vitamin D supplements. And then once they come back for the 6 and 12 week, come back, return, we're going to be measuring we just want to see if there's been a difference on their vitamin D levels. So like I said, it will help with bone and muscle strengthening. We also want to see if menopausal symptoms reduce with the intake of vitamin D supplementations. We also want more women to get physical exams and visit the OBGYN more often. We will provide voluntary doctors to check these women's health free of charge. And towards the end of the program, we will perform a blood test to see if there was a rise or decline in vitamin D levels. A survey will be given out to get feedback back to us to see what these women thought about taking the supplement, and we want to know if they felt like there was a change when it came to their strength, mood, and overall health. And we're also going to have a group discussion. Will be open for all women so they can relate and provide their own experience on going through menopause. So in general, this whole program is just trying to get to see where they're at and evaluating them and giving them the necessary materials for them to make a change. So recommendation, we recommend that women continue to follow a diet that is nutritious and high in vitamin D. We recommend regular health screenings. Women should also be encouraged to get over-the-counter vitamin D supplements with a dose of 600 IUs to start, and to also consult a doctor if the dosage should be raised. We also recommend that they continue to have at least 30 to an hour exercise outside to get the natural vitamin D from the sun. We also want women to spread the word on how they felt on taking vitamin D supplementations, especially before and after going through menopause. We want new people learning about this topic by real people that are going through the change. So the short and long term. So our short term is to educate and bring awareness of vitamin D deficiency, understanding the signs and symptoms of menopause and postmenopause, know the different ways of getting vitamin D through sun exposure, diet, or supplementation, and we also want to reduce menopausal symptoms. Our long-term goal is to get funding from local or governmental facilities, expanding this program, and teach the importance of women's cycles in schools and health clinics. We want to expand our program to other states. We also want to increase the bone and muscle strength for women that are going through menopause. We also want a rise of visitations and physical exams in OBGYN. And we also want to bring more healthcare professionals volunteering and bringing awareness of our program. So the funding. So there's 4 organizations that I would like to ask for funding for. It's Molina Healthcare of Nevada, Women Health Connections, local clinics, and Fund for Healthy Nevada. Our program is a cultural focus and community based. We believe that it's important to focus with our local Hispanic leaders, health workers, and organizations that understand the need of helping underserved communities. Hispanic women often experience disparities when it comes to healthcare access, especially in preventive and hormonal care. By receiving funding, we will not only provide education and healthcare screening, we will also prevent any preventable disease. The amount of funding I'm asking for is $5,000. Research show that 69.2% of Hispanic women are vitamin D deficient and will most likely stay deficient throughout their lives and will continue to have a difficult time during menopause, through menopause. Through menopause and their overall life. The funding will be used to provide women with vitamin D supplements for those that choose not to get health screenings due to personal or religious reasons. We want to give women the opportunity to learn how to take care of their bodies without judgment. We understand that starting menopause is a difficult process, especially in the Hispanic community, where women believe that it is a sign of age or loss of femininity. With time, we hope to reduce stigma and raise vitamin D levels. And these are my references. Thank you.